two times in life where it can be really hard to be a woman. Puberty is one of them, but going through menopause is another. And we're going to talk today all about what to expect when you go through it, why things are happening, and of course, what you can do about it using research-backed tools and tips. So I'm sitting today with Teesa. She is a colleague of mine at VivaWise Functional Wellness. She is a functional medicine nutritionist. And she's going to talk more about perimenopause. It's a topic that she's done a lot of continuing education on in order to help her patients better, and has served a lot of patients and helped them with their symptoms and be able to actually enjoy this time period of their life. So as we get going, Teesa, thank you so much for being here, and tell us a little bit about when we should start expecting this. What is normal? I know some people can through it in their 40s or 50s. With women are like, I'm starting to get symptoms. Is this perimenopause? How do they figure that out?
So the average age of symptoms kind of starting is around 47, but really this transition period can last anywhere from 6 to 10 years. So while 47 is the average, it can be earlier, it can be later, but it does last a while. And like you said, this is a big time of transition. It's often referred to as kind of reverse puberty, because during puberty, our hormones are increasing and we're having these weird symptoms. And it's kind of the opposite of that. Our hormones are decreasing and we're having these symptoms. And so we're not feeling the same, and we can really feel that.
Yes, and it's not like just even feeling the same. It's like everything doesn't work the same, right? So how does someone know if they are, so they start getting symptoms that can go on for 6 to 10 years. How do you know when that period ends? Like, when have they actually become menopausal?
Exactly. So menopause is considered to be 1 year after having no menses cycles. So 12 months of no cycles, you're considered fully in menopause. And the
Being a
bummer,
period, right?
yes, right, sorry, without a menses or a period. But if you can go 10 months and have that period, you've got to start it all over again. So it is, officially 1 year of no bleeding, and then you're considered to be fully in menopause.
Gotcha. And what are some of the symptoms leading up to that 1 year, or do the symptoms start after the 1 year?
Well, they can certainly start at any point in that process. So they might be right when your hormones start reducing, or it could take a couple of years for you to really notice those. But oftentimes, those symptoms become so significant that 90% of women are going to seek some kind of medical care. And they may not realize it's their hormones that's causing the problem that they're having, but it definitely impacts every part and system of the body, because we have hormones throughout our whole body and in tissues throughout our whole body. So as those hormones decline, it impacts every part of our body. And often things like shoulder pain or weird aches and pains, we don't associate those with reduction of hormones. And so often women are going to the doctor and they don't really know what's going on with them. They think they have some other physical problem, but it really is the result of those hormones lowering.
Yeah, because the hormones are anti-inflammatory and they help to keep us calm. And so when you start having less of them, your inflammation goes up, your anxiety goes up. And yeah, we might not know that that's partly coming from the hormones. Now, of course, the hormones they're going to reveal what's going on. They're not just simply causing it, right? And so it's like if you've done some things that create inflammation throughout your life, like we all have, and then you start losing your estrogen, it's not allowing you to buffer anymore. And so it's not like you go get hormones to replace what you're losing and everything's fixed, right?
Exactly. So, even declining estrogen and progesterone can increase pain from gut symptoms like IBS. And so, even, things that we wouldn't necessarily associate with a hormone can be really impacted by those lowering of hormones. And so, you're right. Somebody can go get on hormone replacement therapy. It isn't necessarily going to reverse that IBS symptom, right? But it can certainly worsen that.
Yes, exactly. And this can happen in the years leading up to that 1 year of not having a period, during that 1 year of not having a period, and then for some years afterwards. So yeah, it can be kind of hard. So what are some of like the symptoms? Because IBS is something we can have without going through perimenopause. So what are some of the specific symptoms that would make a patient be like, okay, there's inflammation, there's gut stuff, but this is probably going to be due to my hormones. I think I am actually perimenopausal, which means hormones are fluctuating as you're leading up to that 1 year without a period.
I think most of us are aware of, hot flashes or night sweats, and these are kind of really common symptoms. And a reduction in our sex drive. I think most of us are familiar with those. But we can have mood swings. Certainly, our cycles are fluctuating, where they're getting longer and farther in between. We might have some insomnia and some brain fog, and these are kind of the more well-known symptoms that I think most of us associate with lower hormones. But we can have other symptoms that we may not be so familiar with, like a worsening of pain in the body, right? So I think studies show that about half of women experience some kind of joint pain or arthritis pain during this time. And the most well-known are the shoulder and the hip, right? Where all of a
Mm,
sudden this frozen shoulder, or there's
yeah.
that are happening, and maybe you don't have an injury. It doesn't really seem to relate to your lifestyle, but you're having these aches and pains, and even insulin resistance, right? So we can have a harder time keeping a stable balance in our blood sugar because our hormones are fluctuating, and our sex hormones are based on that blood sugar. So if our blood sugar is changing, our hormones are changing. And so it becomes really important to manage our blood sugar and have stable blood sugar during this time. So it's
And
going
when
to
your blood sugar goes up, what does that lead to?
abdominal fat, and then we're going to have more increase in hormonal shifts, and so it kind of becomes this domino, right? We can even have crazy things like heart palpitations. I've had several clients come to me thinking they're having a heart attack or heart issues, and really, really scared, and it's really just a drop in their hormones, but they're really feeling nervous that there's some major health crisis going on, because these
Yeah.
are things that we're not necessarily talking about. So we think, oh my goodness, this must be a major problem, but it really is just another symptom of lowering hormones.
Yeah. And just like with the going longer between cycles, you also sometimes have the cycles where you're really short, right? I had a patient a couple of weeks ago who went 6 months and then she had two periods in 3 weeks. And so the kinds of symptoms that she would have during those 6 months would be different than the kinds of symptoms she had during that 1 month period where she had two. And so it's not like, okay, which one of these are you experiencing? It's like you're experiencing all of them at different times throughout it. And we're going to talk a little bit at the end of this video about Teesa's experience with perimenopause and what she went through. So make sure to stick around for that. So that's some weird symptoms. You wouldn't expect your hip and shoulder pain and IBS and that kind of stuff. But we definitely, I think women can tell that they start gaining weight and start having some labs that don't look as good when they go through this transition. What is another common symptoms that patients can get when they start to have this transition?
I think one of the ones that a lot of women experience are mood, right? Because what happens during this time is our body produces a little less of the serotonin and GABA, our happy hormones, and we're
Mhm.
producing more of our cortisol and epinephrine. So we're feeling stress more, we're feeling anxiety more. And certainly this can lead to kind of feelings of depression, and we can struggle with sleep. But really, we just have less resiliency, meaning we
Mm.
feel and get stressed more quickly. And one of the things I hear often from my clients is, I just don't feel as happy, or I'm snapping at my kids, or I'm kind of depressed, but I don't really know why. Nothing's changed. There hasn't been an event, but I don't feel the same, and I can't figure out why. And
Yeah.
that is a really common sign of lower hormones.
Yeah, and you mentioned cortisol and epinephrine. Epinephrine is also known as adrenaline, is kind of the common name for it. And these are your stress hormones, right? So if you're increasing those and decreasing the ones that make you feel balanced, then it's just like, yeah, you're like always on edge, right? So it doesn't take as much in
Right.
order to have things get a little bit more out of control in terms of your symptoms.
Yeah. And I find a lot of women end up, thinking there's something emotionally or mentally going on. They're talking to their doctor, they're getting put on an antidepressant or an anti-anxiety medication.
Mm-hmm.
But really, the problem is their hormones are low, and they're not even thinking about that.
Yeah, but not everyone has these symptoms, right? Some people go through perimenopause, they get hot flashes, but their mood is fine, their heart's fine, and they're not having palpitations. So, what's the difference? Why do some people seem to go through it kind of easily and then others have a much harder time?
Well, there's definitely factors that can make it worse. So the more stressed we are, the worse this hormone fluctuation and or the feelings that we're going to have can become. Certainly being sedentary or not exercising right, then we're more inflamed, and we're going to notice that more as
Mhm.
well. If our blood sugar is dysregulated or we have any kind of metabolic dysfunction, that's going to worsen it. And all of those.
And metabolic dysfunction means things like high cholesterol, high blood pressure, high blood sugar, excess weight.
Exactly. And that's just going to worsen these symptoms. And all of those things are related to inflammation, right? So inflammation from any disease or being overweight or having some dysregulated metabolism driver is going to cause, us to have more fluctuations, therefore more symptoms. And then things like alcohol and isolation, there are other factors that can contribute to it. But even with some of those things, I think naturally some people just tend to handle it a little easier than others, right? And so I've had clients that are stressed and sedentary and they still don't feel those symptoms. And so I think there's also some genetics involved as well. And that can be a little bit of a factor.
Yeah, there's definitely a lot of genes that are involved in how your body responds to stress, and what your neurotransmitters are doing and things like that as well. So, the things that would worsen menopause would then, if you do the opposite of those things, it makes it better, right? So walk us through for those of us that are either going through it and are like, I need help, rescue me, please.
Right.
Or those of us like myself, who's in my late 30s and being like, all right, I just want to make sure in a few years things don't get out of hand here. What can I be thinking about for the future? What are some things that we can do?
Love that. But certainly as you're, kind of getting near that age of, 47 or a little before that, we want to think about what do we look for, but also what can I do now to make sure that this is an easy transition, right? So managing stress, really, really important because that does dysregulate everything in the body, including our hormones. And so, sometimes we can manage our stress, our external stress, but we can always manage how we handle that stress in our body. So really having good mind-body techniques for managing stress, super important.
Yeah, and
We
this is something that we spend a lot of time with our patients on, and they're always surprised about. But when we ask them at the end, to tell us about their journey, if they leave like a testimonial or a Google review, that's what they always highlight. They're like, I didn't expect this, and it changed everything when we were able to work on that stress state and help my body get out of a stress state.
I think we often think there's that stressor or not. We don't think about, well, how do we handle or manage that
Yeah.
stress,
Yeah.
right? And it's a big component of what impacts our hormones. And so having some stress recovery, stress management, really critical. And I'd say that's probably number one, right? But then also we want to look at stabilizing our blood sugar, which of course stabilizes our hormones as well, and having a healthier body weight and body mass index. When we have higher weight or we're having weight fluctuations, this is going to be the biggest trigger for our hot flashes and mood swings. And so really having a stable weight is helpful. So if you're kind of getting near that age and you don't have a good exercise routine or you're not doing something to kind of manage your weight, that's a good time to really start bringing that in because it's going to be really beneficial.
Yeah, there's a lot of very specific dietary advice that we give patients that they wouldn't have thought of that helps them to keep their blood sugar stable. And when you keep your blood sugar stable, it's also easier to maintain a healthy weight. But your circadian rhythm has a huge impact on that too. So we talk to patients about meal timing and sleep timing and those things. So yes, if patients listening to this, it's not just like, hey, drop the soda, don't eat dessert every day, you're good,
Exactly, and there's foods we can bring in that actually help balance those hormones, right? So we don't feel that impact of the fluctuations as well. So food is a big one. Benefits and, negatives from that. And, alcohol is another one and something we don't necessarily think of. But as we get older, a lot of us notice we just don't tolerate alcohol as much or we don't feel as well. And one of the things that it can really do is it can really impact our blood sugar, which therefore impacts our sleep and our mood. We can have more hot flashes. And so, drinking at night before bed, which is often when somebody's going to drink in the evening with your friends, that's going to spike your blood sugar. And often you're going to start waking up in the middle of the night. And that's one of the things I noticed, and a lot of my acquaintances and friends noticed, like, oh, if I have that glass of wine at night, I wake up. I have really poor sleep. We are losing a little bit of tolerance here, right? So that becomes more impactful to us than it was when we were younger and we could have that glass of wine at night and it didn't bother us, right?
Yeah.
So I love the podcast you did on, if we're going to be a drinker, be a day drinker, right? Allow the body to have enough time to manage and flatten out that impact in our blood sugar before we go to bed. And so even things like that can make a difference as we're going through this transition. So watching what we're doing for our blood sugar, staying physically active to have a more stable blood sugar, right? And have our hormones be a little bit more sensitive can be really important. And
And
we want
exercise releases stress too.
Exactly. And we want to prioritize our sleep. It's really important for us to have a good sleep. And I think, often our sleep is impacted by our hormones changing, and we think, well, I just don't sleep well, and we don't really address it. And it kind of becomes a snowball. It's really important we address sleep. It's critical. It's when our body's repairing and healing and detoxifying. So
Yeah.
we want to make sure we're prioritizing that as well. And of course, if we need some hormone replacement therapy, that's something we can turn to, and that can help a lot of women in this transition. And I think that's another thing that's a misconception. We think, well, we have to be done cycling, or we have to be in menopause to be
Mhm.
given hormone replacement therapy, but that's not the case. We can often bring it in during the transition to make everything easier and help us. And so if that's something that we need, or it would be helpful, I think it's certainly something to consider.
Yeah, especially progesterone. And then we have our own version of hormone replacement therapy, which is 2 tablespoons of flax meal, which is an amazing intervention. It's got good evidence for it, and it really works for our patients. It's so cool to be able to recommend something related to diet and to be able to see effects pretty immediately.
Right, right.
Yeah, because flax meal binds to estrogen receptors, so it'll help to kind of balance out. You don't get like the big dips and spikes when it binds the receptors. It kind of like turns it into a little bit more even keeled of a transition.
And some cruciferous vegetables, and we've got some, great natural alternatives. But if that's not enough, certainly we can look
Yeah.
into, hormone replacement therapy.
Yeah. So is that something that you did, or what was it like for you when you went through this
Not
transition?
replacement therapy. So while the typical pattern we've discussed today of kind of, 47 and 6 to 10 years of transition, and that's kind of typical for most women, some of us, like myself, have gone through menopause earlier than normal. And if you're somebody who does have this transition happen earlier in life, it's really associated with having worse symptoms. And that's something I experienced. So
Mm,
I started having, well, first of all, I have a history of hormonal imbalances, including PCOS and infertility. And I've struggled with all of this throughout my life. And unbeknownst to me at the time, I really started having symptoms in my 20s. With infertility. And then I started having daily hot flashes in my early 30s. And my doctors kind of went, oh, well, they didn't really have an option for me. And so I struggled for 10 to 15 years with hot flashes. It was awful. And I was completely done cycling before around 40 years old. So I was really, really young. At the time, I was having some health issues. And so my doctors did not recommend hormone replacement therapy. And I'm really sad that I didn't do more research and I didn't know more about that. I just said, oh, okay, you're telling me not to do it, don't do it. But it was a really hard transition for me. So I had to figure out, well, how do I naturally do this? Because I wasn't being offered any options or
yeah.
and so I was able to really bring in a solid exercise routine. I really watched my diet. So I ate a very low inflammatory diet. I stabilized my blood sugar. I also, avoided gluten and dairy, which were very inflammatory. I had to have stress recovery practices. And I knew, anytime I felt more stress, all of the symptoms would worsen. So I
Mhm.
really see that impact. And of course, exercise is a big stress reducer as well. Alcohol, right? I had to stop drinking alcohol at night. That was really a big one for me. And I hardly drink it at all now. I'm just very sensitive to it. And so those things helped me in that transition. But, if I could go back and I knew what I know now, I would have done things a little bit differently, right? And
Yeah.
so we are learning more about the body. Back when I went through this, we didn't have as much information, and now we do have a lot more information. And I think it's really important for people to inform themselves of all of the
Yes.
different options.
Exactly. Yes. I'm, so glad that you still did, had some healthy lifestyle changes that you can make so you didn't have to suffer as much. If any of you are struggling or want to prevent struggling listening to this, we'd be happy to help you by seeing you at our practice, VivaWise Functional Wellness. You can get the link in the description. And we just are here to help you to make informed decisions for yourself. So if you do want more evidence-based tips, please subscribe to our channel.